I'm Stanley, and I'm a retired battalion chief from Belleville Fire Department in New Jersey. My medical condition before I came here, I had a back problem. I was diagnosed with stenosis, and I would have occurring issues, severe pain, emergency room visits, and after seeing an orthopedist, she recommended I see a neurologist. I saw him, and he said that it wasn't my back, but it was my hip, and my hip was degenerating, and he suggested a hip replacement. They also suggested that I wait as long as I could because I was still in my 50s at the time. And they said, wait until it's really affecting your life, which I did. The most challenging part was the chronic pain, sometimes severe pain. There was emergency room visits because it was so bad, like it was a gripping pain. Once I was diagnosed and I had to have the hip replacement, they said, wait as long as you could. And then little by little, I started to lose function as far as I couldn't play golf. I couldn't get in the kayak. I couldn't ride my bike. That was the last one that went. It was just such severe pain that it affected my life.
Stanley came in with a total hip replacement on his left hip. He came in 3 weeks after his surgery, so naturally he was really nervous. He was really worried about what to do, what not to do. And so when the moment he walked into our facility, we wanted to show him that this was the most comfortable and optimal place for his rehab. We showed him the movements that he could do, movements to avoid, just to protect the incision site. And over time, we wanted to strengthen his muscles and get his range of motion back to maintain his quality of life.
The way it affected my personal life and my relationships was my mobility. And when my mobility is compromised, it's devastating because you can't walk, you can't bend. Bending down to pick up something, a piece of trash, is an effort. You're always looking for that table or that chair to stabilize you when you're getting up. So it's that conscious awareness and then the chronic pain.
When Stanley came in with his total hip replacement, he was very hesitant in walking. He was limping a lot, and so we wanted to show him, yes, you can properly walk, and making sure that he's doing the proper movements to protect the area and allow it to continue to heal. I know he mentioned he really wanted to return to playing tennis, and so over time we laid out every game plan. Every time he came in, every visit, we laid out a game plan of how we can achieve that goal. Slowly and steadily, we strengthened the hip muscles, we strengthened up his quad and hamstrings, all the muscles surrounding the hip, so that he could ultimately get back to his enjoyment of life.
So my brother passed away, and his best friend was his grandson, who's 7 years old now, and he's playing football and stuff like that, so I tried to jump in and be the best friend that my brother was. And when I couldn't run around the park and chase him in the park or cross the parking lot with him, because he likes to run. He's 7 years old, he runs everywhere he goes. And my mobility was restricting me from that. So now that I'm on the mend, I feel better. I could chase him around a little bit. We go to the park, we play football, we play catch and stuff like that, chase him around the jungle gym. So that's something that's very important to me in my life.
So the last I saw Stanley, we were again hammering home tennis-related movements. He's been getting better and better. His endurance is increasing, and his strength in his hip is really drastically improving. I hope to see him on the tennis court very soon.
The way it's affected my happiness and overall outlook is I'm just happy to be normal again, because the chronic pain, the gripping pain that just stops you in your tracks, that's gone. I don't have pain. The hip is fine, and now we're working on other parts of my body. The back, shoulders, the legs, and I'm working out again. It's something I haven't done in years because of the pain in the hip, because it was just too much. And I feel better. I feel more confident. I don't have to worry about trying to get into a car or anything like that. So just the everyday things and doing them and being normal is just thrilling. It's my body. They're making me well. That's important. Because I've never been in this spot before. I've taken care of a lot of people. I've done medical transport, and I've seen people who need physical therapy. And this is a healing place. You know, it's people who are getting better and had surgeries and stuff like that, traumatic or whatever. My wife's excited because she sees me and the progress I'm making. I talk to people like, oh, I just had hip surgery. Oh, when? 2 months ago. Oh, wow, and you're walking? Yeah, I was walking the first day. But I've come around and I'm going up and down stairs, and you wouldn't even know it if I didn't tell you that I had hip surgery 3 months ago. So I'm thrilled with the progress. I try to be a good patient. That's what I would say to anybody else. Come here, be a good patient, do what they tell you to do. Don't give them a hard time. Be happy that you're on the mend and on the road to recovery. And that's what I like about here, because you're always on the road to recovery. And there's never any, oh, we can't do that. Oh, we're not going to do that. You're not going to be able to do, oh, you can't play golf for a year. It's like, we're going to get you there. We're going to get you there. And then they do it, and I'm getting there. So I'm thrilled.